Wrinkles. My name's Jane Parker, Monterey County Supervisor, District 4. Welcome to one in the series, oh, I see videos now, of our virtual hot topics. I'm really pleased we have a special guest this evening, Dana Edgull from the County Health Department Behavioral Health, and she's going to help us with some strategies to stay sane while we're staying safe from the virus. And but before I turn it over to Dana, I did just want to kind of review some of what we know about the shelter in place and kind of what's going on the ground in our county. So just a few general things, and if people have comments or questions, feel free to use the chat feature or communicate however it happens on Facebook. You can also raise your hand, although I think we will probably just go into Dana's presentation. But I did want to just remind you that in the last week, quite a bit has happened. We have a mandatory face coverings order, which means that whenever we go out and we are going to encounter other people who are not members of our household, that we should have our faces covered. This bandanas, repurposed t-shirts, any number of, plus some of these cloth masks that are being made, as well as some of the paper ones can be used, but I really encourage us to use ones that can be reused, like bandanas or some of the homemade cloth ones. They can be washed in between and used again. Apparently there's quite a bit of, paper mask, one-time use gloves that are showing up in landfills, and of course roundabout in just the general favorite littering spots. So I really encourage us to use the ones that we can use again. Apparently there also in the last week we have had the news that there will be increasing testing capacity in the county, and that is actually going to start tomorrow. So there are 2 locations. This is part of what was announced at the state level, that throughout the state there will be 80 additional COVID-19 testing sites. We have 2 in our county. One is in Greenfield that will open tomorrow, and the other is in the Alisal part of Salinas, and that will open on Wednesday. Both sites will be open Tuesday through Saturday, we think, 8 a.m. to 8 p.m. The first priority will be first responders and essential healthcare workers to be tested. But once we get through those priority people, those 2 sites will be open to the general public. So that's going to increase our testing capacity by about 3-fold. So that's a really exciting development. And both of those things, the face coverings and the testing, are steps along the way towards the criteria that the governor put forward for us to be able to open. There, now you can see me as I look today. These are both steps to get us in line with the criteria that the governor has put out for and further easing of the shelter-in-place orders. And then also taking effect today is a change in the shelter-in-place order for Monterey County, and that allows construction to get back underway, landscaping operations also to get underway, and golf courses to open, plus some youth camp opportunities, all still with mandatory face coverings, social distancing, and we're going to see how that goes. Hopefully it won't result in too many more cases of COVID-19 positive tests, but we'll see. And then, as you probably know, the governor today announced that he's prepared to, at the state level, ease some of the shelter-in-place restrictions even further. And our county health officer has put out a statement saying that he will be reviewing what the governor has put forward, and he will be looking at how to translate that to Monterey County. So a lot of things going on. And in spite of all of that, we still are under a shelter-in-place order, which, as some of you have probably experienced, can create a little bit of stir craziness and just general anxiety and sense of being kind of isolated and cut off from friends and family, and just a sense of cut off from what used to be normal. So that's one of the reasons that I have asked Dana Edgull to be here today to let all of you know about some resources that are being made available through the Monterey County Health Department's Behavioral Health Division to help us cope with the shelter in place and some of the normal difficulties that we may be experiencing, and strategies to keep ourselves sane and treat the people around us with a fair amount of kindness and respect, which can be rather difficult sometimes. So Dana, I'm going to turn it over to you, and I just want to thank you so much for being here. We really appreciate all the work that's gone into this Forward Together set of resources, and really glad that you're here to walk us through how those can work and be available to us.
Thank you, Jane. I really appreciate this opportunity to be here with you tonight and with other residents of Monterey County. And I want to acknowledge just you've been such a longtime supporter of mental health and been such an advocate in helping us get the word out and really being an advocate to help us fight against stigma. We know a lot of people don't access mental health resources, even though most of us at some point in our lifetime will have a mental health challenge. The stigma and the negative connotations that still exist around mental health and mental health disorders can be a barrier. So I really am grateful for this opportunity. And some folks may know that every May is actually Mental Health Awareness Month. So this is perfect time for us to talk a little bit as well about mental health awareness and some resources. And so I did prepare a presentation to go through where we can we'll touch on and talk on some things talk about some things, Jane, that you mentioned. So bear with me while I share my screen. So do you all see a beautiful slide that says Forward Together Avanzando Juntos?
I do.
Okay, perfect. Okay, this is my first webinar that I've done and first Facebook Live. So bear with me a little bit. I'm going to try and move this little bar out of my way. So as Jane mentioned briefly, Monterey County Behavioral Health has initiated a series of different workshops on different focus areas, and I'll tell everybody how to access that a little bit later in our presentation. So again, thank you, Jane and Wendy, for this opportunity. And I think it's really important for us to think about as a community that this difficult situation that we're in, as difficult as it is giving us some opportunities to look at how do we take care of our health, our mental health, and the stressors in our lives. And if we can adapt some new practices, some new strategies, some of us do have a little bit more time on our hands, and I'm going to offer some suggestions of things that people can do. And so we might find ourselves coming through this actually a little bit stronger and a little bit more resilient. And we know that there's a lot of strengths in our community, and we really want to lift those up. So bear with me while I see if I can have my slide go to the next slide, which of course it's not cooperating with me. There we go. Okay, so I thought it would be helpful for us to all together do something that we can do we do every day, and that if we do it with intention, it can really help our bodies to relax. So this slide has a kind of a little graph that walks us through a 4-square breathing. So I'm hoping that everybody that's with us right now will go through 3 cycles of the square breathing. And so you can see that there are numbers 1 through 4 on each phase of the square. And so what we will do at your own pace, but kind of count to yourself. You'll inhale to the count of 4, hold that breath for a count of 4, exhale for a count of 4, and then just kind of pause. So I'll have us begin, and again, go through this at your own pace. So we'll breathe in, we'll hold, we'll exhale, let our bodies rest. We'll take another breath in, hold, we'll exhale, we'll pause, we'll breathe in, hold, exhale, and pause. So for those of you who did practice with us, I don't know if anybody would like to share in the chat with us if you notice how your body's feeling now. And if we do have anybody that is able to share, maybe Wendy can share some comments with us. If not, we'll move on and talk a little bit more about kind of what we're currently dealing with. So with COVID-19 and shelter in place, this can be very stressful for people, and it's normal to feel anxious. There's a lot of grief and loss happening right now. People are isolated from their support systems. Some people are feeling a little hopeless, wondering when the situation will change, and there can be a lot of increased stress during this time. And as I talked a little bit earlier about how we cope with our emotions really can have a positive impact for us and on our stress level and for our health and well-being, and that we can really come through this stronger. So I'm curious if I see a few chats. I'm curious if we can see them. I don't know if I can see them from my vantage point. Oh, good. Okay. So some folks are sharing that helped you feel more grounded and focused. And a good reminder. Oh, thank you. I got some hugs, virtual hugs from the chat. And thank you for joining me in that. And again, just to really emphasize that our breath is with us all the time. But when we're stressed and we're anxious and we have a lot going on, a lot of us, we kind of forget to breathe. We'll have tightness in our chest. We'll hold our breath. We won't let that kind of healing oxygen come into our bodies. So thank you for participating in that and for sharing your experiences with me. So I'm going to see if I can get back to my slides. Here we go. Okay. So we hear about resiliency. And so what does that mean? Resiliency is kind of, we all are resilient, and it's the process of adaptation in times of adversity, trauma, tragedy, kind of what we're going through right now, any other type of stress. It's how we can move through things and adapt and change. It's the ability to bounce back and keep going. And as we think about other times in our lives where we've gone through really stressful times, if you can reflect on those times and remember how you felt afterwards, when you overcame a difficult challenge, you persevered through something, we usually have some new insights, we have some new perspective. Sometimes we feel more confident and more capable in our own abilities. So as we move through things, we can learn things about ourselves and have kind of more tools in our toolbox as we move forward. Whoops, that's the wrong one. So I wanted to talk a little bit about our mental health. And so sometimes we only talk about mental health when we think about negative things, like when we're feeling depressed or anxious, we think that's mental health. But our mental health is with us all the time, and it exists on a continuum. Kind of on the green side is when things are well, we're balanced, we're able to function and cope well with stressors are in our environment. And then as things kind of heat up a little bit, things are getting maybe a little bit more intense in our environment, we're experiencing more difficulties, kind of all the way to the right-hand side or the red side of the spectrum, when we're really under a lot of stress, we're at our breaking point, we're not making good decisions for ourselves. And that we really need to recognize some of the warning signs before we get to that boiling over point, because it's really hard to, to cool things down when you're boiling over versus when you're just starting to heat up a little bit. And so when we think about our mental health, you can think about kind of three kind of interconnected systems. So our bodies, very important. Just doing that simple breathing exercise can help us to feel a little calm and more calmer and a little less anxious. In terms of our mind, our thoughts, I don't know about you all, but when I start to worry and think about things, I feel my heart racing a little bit more. I start to feel a little bit more stressed out. And if I can pause, take some deep breaths, kind of move into some mindfulness, and try and stop those thoughts from being repetitive and from kind of worrying over and over, that really can make a difference. So it's how our mind and our body and our emotions all work together. And one change in any part of this little system really can positively or negatively impact the other parts of our mental health system. So this slide just kind of reiterates some of what I talked about before, that when we're kind of at the green end of the continuum, we're balanced, we're chill, we're able to take care of things in our lives, we're functioning pretty well. And then as we start to have more stressors come into our situation, sometimes we might have a harder time concentrating, maybe we're not sleeping or eating as well, maybe our self-care starts to slip a little bit. We get so focused maybe on work that we're not taking breaks that we need to, or we're worrying a lot. And so we're starting to have some kind of impacts. And then when we get to the far end of the continuum, that's when we're starting to feel kind of desperate and hopeless, depressed and anxious. And that's really a time when we need some help for sure. Though if we can again recognize the warning signs sooner on, that can help us to prevent ourselves from getting to a point when we're really feeling a lot of distress. So I thought it would also be important to talk a little bit about stress and how physically we are impacted by stress. So a lot of people have heard about the fight or flight response. And that's something that is just biologically wired into us. We have needed, we've survived for a long time on this planet. And a lot of that has to do with the fight or flight response helping us. So when we've been in situations where a stressor, a threat comes into our environment, our body, boom, our stress hormones get triggered. We have adrenaline that comes into our body. We get ready to take some action. We get ready to fight off a defender or fight off an offender, to protect ourselves. People have also heard of freeze. Sometimes in these situations that you can't fight or flee, so you'll kind of freeze until the threat is over. Or sometimes we find ourselves having to accommodate that threat. So there's different ways that we respond when we're under stress. But I think most importantly to know that our bodies, they get this rush of adrenaline. It gets this rush of stress hormones. And so we really need to be able to have ways to discharge that stress. And the tricky thing about being under kind of the COVID-19 and shelter-in-place situation is that a lot of us feel that we're constantly under this threat. And it might not be experienced as a real dangerous situation, but it's kind of this underlying constant threat to ourselves, our family, and our loved ones. And so a lot of us are feeling a little bit dysregulated all the time. And that can be just as stressful to our bodies and our systems as having the bigger stressors, if that makes sense. So it's in some ways, it's more important now to make sure that on a daily basis, we are all doing something that helps our mental health and our well-being, and particularly how it helps our bodies to be able to discharge and relax and respond to the stressors. So everyone reacts differently to stressful situations. So if you're having a hard time right now, do not beat yourself up. Most of us are having a difficult time right now. And for people that have been through a lot of other prior stressful situations, if our support systems are a little thin, if we've had some difficulty with as children growing up, with the adult role models in our lives, if they didn't handle stress in healthy ways, that's been our learning models. And so I think one of the messages I really want to share with people is to really be kind to yourself. Be gentle with yourself. Your self-talk that everybody kind of engages in. The messages that you give to yourself right now are really important to remind yourself that we're all doing our best right now, that we've been through stressful times like this before, and that we will make it through it. Though if you know you're a person who has been through some difficulty, maybe you have some pre-existing mental health conditions, it's really important to be reaching out for help and support right now. And I definitely will touch on some resources before the end of our talk today, and we'll have a chance to ask some questions too. And then also, a lot of us have had positive experiences. We've made it through difficult times in the past. We have people in our support system that can help lift us up. And so for folks that have strong support systems and positive experiences making it through some challenging times, their response to stress will be a little bit different. Okay. So I'm going to move on to, I was just checking our chat to make sure that we didn't have a question come up, and go to my next slide if I get cooperation. Okay. So really important to know that a lot of us are having difficulty right now. And so it's not uncommon to have some fear or worry about your own health, the health of our loved ones. I myself, I'm a mother of a 21-year-old, and he's down in San Diego. And yes, I've had a few sleepless nights worrying about him. Hopefully he'll be home on Wednesday. But yes, I definitely can relate to having loved ones who live in a different area that we're concerned about. Changes in our sleeping or eating, especially when this first started happening, I found myself having some nights where I was really having a hard time going to sleep at night, and sometimes waking up and finding myself worrying a lot. And so when that happens for me now, I really remind myself that in this moment, I get myself back to being oriented to the present moment, that in this moment, I'm doing okay. Most of my loved ones and my family members are doing okay. Just little gentle reminders that in this moment, remembering what we know and coming back to the present. Again, a lot of us are having some difficulty concentrating, and sometimes if we have chronic health conditions, those can become worse. And it's not uncommon for people to go to what we call kind of self-medicating. So going for a drink, alcohol, using tobacco, using other drugs. Those things, so unfortunately, are not going to help us to heal. They're not going to help us to really feel better in the long run. It's kind of a quick fix. It helps us to feel better in the moment, but it doesn't help us come back to that kind of sense of balance. So again, even though these are normal, and if you found yourself participating in some of these things or experiencing these things, do not beat yourself up. Just be really mindful. Are they becoming patterns for yourself or your loved ones? Because that's when we start to have some problems. So what can we do? There's actually quite a few things that we can do. And I think one of the things is to really look at how much news and media. Now, tonight is positive, where we all need to stay on top of what's going on. And Supervisor Parker, I think it's great that she's having these community events so that people can get information from a credible source in a way that makes sense. But I would also just encourage you to think about, when are you listening to the news? When are you tuning in, and for how long? And think about, is it at the beginning of the day or the end of the day? Is it going to be at a time that helps you to digest that information? Or is it at a time that's maybe going to disrupt your sleeping for the night? And to take care of yourself. Everyone, again, is just as we're individuals, and we respond individually to stress, we respond differently in terms of what makes sense for us. Some people love yoga. Some people love meditating. Some people that's too hard for them and they need to do something physical. Take a jog, tune into an online exercise class, something that's fun. Zumba for me used to be a lot of fun until my knees started giving me problems, but hearing the upbeat music and getting my heart going and those positive endorphins really can do a lot of good. And then connecting with others. So again, tonight is a really good example of, even though we can't come together in person, we can see each other, we can have some conversation. There's a lot of different groups that are starting to have online forums. There's a lot of church communities, spiritual communities that are having live Facebook events. And I'll share a few more resources towards the end of the presentation, but it's really important to know that there are online recovery support groups. So AA, NA, those are available online. So there's ways that we can still be connected to one another, even though we can't be together in person. So this is just a little slide as a reminder to kind of do what we love to do the things that make your heart feel good, help yourself and reach out to those around you and to help one another. As Jane was saying, that we really need to be kind to one another, probably more so now than ever. And if you do have an interaction with another person where maybe they're not being so pleasant, try and remember that we're all going through a lot of stress right now. So what stops us from seeking help? And I think that's an important thing to talk about. Also in light of Mental Health Awareness Month, a lot of us feel like we have to be strong, that we should be able to deal with this. What's wrong with us in terms of our self-talk? Sometimes we'll think, well, what's wrong with me? Why can't I cope better? I also really want to stress that for a lot of people, the situation financially is very stressful. And so we do, and I'm sure Supervisor Parker has shared resources that are available. Nobody should feel shame if they are having a hard time managing their financial resources and their concrete needs. So concrete needs are things that we need in our lives to survive. And we know when we go through economic challenges, such as we are having now, that certain folks, like if we have a family system or where like the husband or the male in the relationship has been used to being the provider. Well, a lot of families these days, it's multiple people that are working and providing, but if that's been our role and we are no longer able to do that, it can feel shameful and people can feel additional stress on themselves. And so we don't want that to be affecting people. And so it's not, it's nobody's fault right now that the things that we're going through. And so reaching out for help for your mental health and also for resources and supports to take care of yourself and your family is very important. It's actually a strength to be able to ask for help. So what help is out
Sorry,
there?
Dana, I'm just going to interrupt because there's a question that has to do with something you said, I think on the last slide.
Okay.
Alan is asking if you could define what is a valid source of information.
Okay, so that's a good question. So I think for me that means going to sources that are credible. So in social media, we have to be careful in terms of the source. So tonight, you know that Supervisor Parker has initiated this forum. I'm from a health department, so Monterey County Health Department Behavioral Health. So I have some credentials. I'm a licensed clinical social worker who's employed by a government agency, and I have 25 years of experience in the mental health field. So I'm fairly credible. Supervisor Parker is a trusted government official who works for Monterey County Behavioral Health, who has direct access to information sources that she is sharing with her community. When we go on some social media sites and we're not always sure where that information is coming from. And so for me, that's what I mean by I think I said valid. I can't remember exactly what I said. And Jane, if there's anything that you would like to add to that explanation?
I think, no, just to support what you're saying, in general, one of the things that I'm trying to do, Wendy Root Askew, Christy Markey, Lori Chappell, my staff in my office, we're really trying to take the information that Dr. Moreno and the trusted folks at the county are putting out in terms of accurate information, and making sure it's as easy as possible for you all in the community to access. Because and one of the things that I've said a number of times is we need to find the ways to get information, accurate, timely information from the county into the hands of people in the community, and into the ears and into the eyes of the people in the community, and not make you go figure out what website you're supposed to access, how many times you have to click to get to the information you're after. No, it needs to be easily available, especially in these times of that are kind of stressful. Sometimes we don't even realize that it's stressful, and yet that difficulty in concentrating, that tendency towards quick irritability, those are the things that I found were clues to me that I was feeling the stress of the uncertainty, and not really knowing how long this was going to last, and all of that. So yeah, just the making sure that we're getting accurate, helpful, constructive information. This is hard enough without scaring ourselves to death by grabbing hold of some crazy assertion that gets put out there from someone else's fear, which then just breeds more fear. So thank you, Dana. Appreciate what you're doing for us.
Thank you. So I'm going to move on a little bit, and then we can have a chance to come back to any questions that we didn't get a chance to advance. So one thing that I wanted to share with everyone is that Monterey County Behavioral Health, in partnership with the Alliance on Aging and Partners for Peace, has initiated what we're calling Forward Together, Avanzando Juntos initiative. And so if you go to our website, and I believe Wendy has shared this link as well, we have different series of different workshops and informational sessions focused in these different areas. They are all in English and Spanish, with the exception of the Teen Connect. Right now, the Teen Connect is just in English, though we have Monday through Thursday, we have English and Spanish parenting informational sessions and topics facilitated by both Monterey County Behavioral Health and Partners for Peace trained educators. We have a great support for new moms in English and in Spanish at different times, because we know that. And actually this week is Maternal Mental Health Awareness Week. And so during pregnancy and after having a new baby, it's so common to have some symptoms of depression and anxiety. And this time during COVID-19 can be particularly isolating. And so we really want to make sure that our new mamas out there and new papas, new dads have the supports that they need. And so that's a really great support for new parents or women that are pregnant. Alliance on Aging has done something really creative. They didn't want to have seniors have to struggle with utilizing technology if they hadn't done that before. So they've developed kind of a series of kind of conversational situations where they have this a voiceover with some pictures and some resources that are very helpful for seniors and caregivers of seniors. And then every Monday and Friday in English and Spanish, we have mindfulness and self-care. And so I'm helping to co-facilitate that with some other behavioral health staff. And probably then just to mention, we have one for educators. That's something we're doing in concert with MCOE, Monterey County Office of Education, and the school districts, and as well as a Teen Connect. That's every Tuesday, and we are in partnership with the Epicenter, which is a great resource for teens and young adults in Monterey County. And so I did share all this information with Wendy, who I think will be posting these resources, Jane, to the different places where you post things. And so it's really important for people to know that you're not alone, that there are many ways that you can reach out for help and support. So then the phone numbers here, the first one is operated 24 hours a day, 7 days a week. It's facilitated by peers, and peers are, in this context, they're individuals with their own lived experience with mental health issues. So they understand how it feels to have difficulty coping at times. And so they're available 24 hours a day, 7 days a week. Locally here in Monterey County, the next one, through our Omni Wellness Center that's operated by Interim Incorporated. They have a warm line where also they have peers answering the phone. They're doing outreach to people in the community, and they can also be reached via text. Another 24 hours, 7 day a week lifeline or line to call is suicide prevention. We know that during these challenging times, there is more depression and anxiety. There can be more hopelessness. And so we really want to make sure that everyone in Monterey County feels that they have somebody that they can reach out to if they're having thoughts of suicide. So that is a number that, again, is available 24 hours, 7 days a week. And the crisis tech support, there also have trained volunteers who are trained to address situations where people are having thoughts of suicide. And that's the last support that's listed along with the SAMHSA disaster distress line. And I'll pause just in case there's any questions related to these before I move on. I don't know if I should I take a peek at the chat, or Wendy or Jane, you're looking at the chat for me so I can know if there's anything I should touch on? Jane, you're muted.
We do have a conversation going on about the credible and, can people contradict each other even if they're otherwise credible and that sort of thing. We can get into that later.
Okay. So if there's any question that you see that's related to the mental health presentation, please let me know. So I'll go to the next slide.
And Dana, we do have a group of folks that are watching on Facebook, and people just seem happy to have the information, so we can continue on. And if there are questions from our Facebook viewers, feel free to jot them in the chat and we will get them in front of Dana and Supervisor Parker.
Thank you, Wendy. So I've done a little research looking into different options for telehealth. And so I haven't personally participated in any of these. They have been fairly well established. The newest one is the last one that's on the list, and I'll be honest, I'm not entirely sure how to pronounce it. IANA, it was mentioned during a briefing that the National Press Foundation had on suicide prevention and awareness. And what was intriguing to me about this entity is that they really have done a lot of outreach so that the therapists and the counselors that are involved with IANA are members from diverse communities. So they represent individuals that are LGBTQ, individuals that come from kind of historically underserved communities, marginalized communities. So that was a resource I hadn't known about. And then the other ones have various ways that they can bill insurance and have sliding scales and have a variety of therapists licensed. Most of the folks that I think that are working in these entities are either licensed or being supervised by a licensed clinician themselves. So if anybody has had experience with any of these and would like to share that, that would be helpful as well. So I just think options are good, and I would really encourage you to look at the different platforms because they all are a little different. So as Wendy and Jane mentioned, I work for Monterey County Behavioral Health, and so our number, that 888-258-6029, I can say that slower, 888-258-6029. That number is answered 24 hours a day. So during the hours of like 8 to 5, it's County Behavioral Health staff, bilingual staff that will answer the phone and will help people to get connected to mental health resources, or if you're having having a lot of distress and you need immediate help, they will help you to get your mental health needs met. We are mostly offering sessions online, but I believe we are also offering some in-person sessions as needed. And then for folks that have Medi-Cal beneficiaries, Beacon Health Options is really the go-to kind of, well, either Monterey County Behavioral Health or Beacon Health Options really is your go-to to get connected with mental health resources, counseling and therapy and psychiatric care. And then if you have private insurance, I really would encourage you to contact your insurance provider. And I put on here a website from Psychology Today. And Psychology Today has a really nice, pretty user-friendly database where you can search for what you're looking for people that are in your area and that offer specialty in regards to the areas that you might be looking for help with. And as I mentioned previously, this because the situation is stressful and it is very common for people to be triggered to have a relapse related to drugs or alcohol. So important for everyone to keep up our support system. So AA has a good online directory, and as well as through the Substance Abuse, SAMHSA, the Substance Abuse Mental Health Services Administration, they have more resources for other types of recovery and support groups. And so, again, this will be accessible to you, this PowerPoint presentation, so you can go directly to the links. And then just a little reminder about other things that we can do in our daily lives. And again, we're all different. Different things are going to speak to us. I would say, I would really encourage everyone to think of something that they'd be willing to try out once a day, if at all possible, and see how that makes you feel. Do you feel better after going for a walk? Do you feel better after having a nice catch up over the phone with a friend? Are you practicing and gratitude practice? So that's a simple way where you have time during the day where you intentionally reflect on and you think about things that you're grateful for. You really, if it's a person, you think about that person, you think about how you feel, what the positive things that you feel when you're with that person, you kind of hold that person in your thoughts in your heart, and our bodies start to produce the positive chemicals, so the endorphins and things that bring about a sense of well-being. So when we reflect on the things, the people, the places, our pets, the things that we feel grateful for, that again has a positive physiological response for us. And so it's 6:15. So if your folks wanted to, I could lead us through a short guided imagery little meditation. So is that, okay, Jane's nodding her head. Okay.
I think that's, that short breathing exercise really made such a nice difference. I think, yeah, a visualization would be great.
Okay. So what I'd like everyone to do is just to take a minute and kind of get comfortable in your seat. I would invite you, if you feel comfortable, to either gently close your eyes or kind of soften your gaze. Take a few deep breaths and get your body centered and calm. So I'd invite you to picture a color that you associate with stress and challenges. Picture the stress and where it is located in your body. Picture the color, the shape, the size. Just notice where that shows up for you. Now, picture a color of healing. Picture a color that resonates with you, that brings forth healing, positive thoughts. Let this color begin to flow over your body, outlining your body and filling you with comfort. As you begin breathing deeply, picture inhaling this color of healing into your body, filling you up, coming into your lungs, bringing that oxygen and the healing energy through your body. As you breathe out and you exhale, picture that color of stress leaving. Taking another deep breath, inhale the color of healing. And exhale the color of stress. Notice what starts to happen to your color of stress. Does it fade or get smaller? Does it disappear? Continue taking deep breaths, inhaling the color of healing, bringing in positivity and strength. And as you exhale, breathing any stress out. I'd invite you to take one last big inhale. Feel that positive energy coming into your body. And exhale one big breath out with any amount of stress that still is there. And when you're ready, I'd like you to gently open your eyes and return back to our conversation. Even though I don't participate all the way with you, I've done this myself, and hopefully that felt some relief for some of you, a little bit more relaxed.
You know, it's interesting, Dana, doing that. If you had described, or just like just the breathing, it sounds so simple. And when I'm stressed, I think, oh, that's not going to make any difference. I'm not going to do that. And yet, if you actually do these things, even just those few breaths at the beginning or this kind of simple visualization, it actually does have an impact.
Yes, yes. And I'll, just a little self-disclosure, I've been a lot more intentional about having self-care in my day, doing the breathing. It's helpful when we're inhaling through our nose to also actually exhale through our mouth with our mouth open. That is also really helpful for kind of engaging our body's response system in a positive way. And so I guess I would challenge all of us, and Jane, you as well, to think about, a time in your day and to really just, you schedule it in. We have to be diligent. Our self-care practice is a practice, right? It's something that we really need to have as part of our routine. So thank you for sharing that. I don't know if, so then moving on, this is the end of kind of my formal presentation, but I'm here with you all for the rest of the time in case there's any questions that related to the presentation or the resources that I can answer.
Great, thank you so much, Dana. Could you, you had like the Senior Connect and the support for new moms. Can you remind us again where we find those?
Yes. So a few different ways you can get to them. So the website down at the bottom, MontereyForwardTogether.org. That is a new URL that we had created for specifically for the Forward Together initiative. I could try it. I might try. I don't know if Wendy is better. I could stop my screen sharing, or I could try and pull it up. We could show everybody where it is on the Monterey County Behavioral Health webpage. If people also go to our webpage at thank you. So this is one of our flyers that we can also we can share, and then. I don't know, Wendy, if you're able to go to our website. Perfect. So this is where we have the different images. And so, for example, Wendy, if you want to click on the mindfulness and self-care. Perfect. Yes. You will be brought to a next a slide where you'll see a little bit more information. The links for accessing the sessions are on the website, as well as the call-in information. And then we also have in each section some additional resources. So here we have the California Surgeon General's stress playbook and some different resources on coping with stress. And there's more online telehealth options. And then thank you, Wendy, for noting that people can sign up for email notifications and reminders, and to follow us on social media. And the calendar is a little wonky. I will be 100% honest with you. So we're still trying to work out some of our glitches, but we tried to make sure that the links and the ways to connect to the sessions are available in each section on the web page, in each kind of discrete section. So does that make sense? And Wendy, if you don't mind, I don't know if you can go to the behavioral health, our webpage. It's not entirely the best, but we have some additional resources for coping with COVID-19, and a little bit of information on telehealth. So underneath the Forward Together, the tab that says COVID-19 resources for coping with mental health. Yeah, the second one there, actually back up a little bit. Two up, perfect. One up. One up. Oh, I think this is not about telehealth, but it's okay. But we have additional resources on coping with COVID-19. It says COVID-19, 2 down. Perfect there. Yes, perfect. Yes. And so there's additional resources for families, for parents and caregivers, and it's in English and in Spanish below. There's a really sweet book that our Children's Behavioral Health Deputy Director created in English and Spanish. It's a great one to help have conversations with children about this situation, because for a lot of us, this is hard to understand, and particularly for kids and for children. And so that's the Angelina, the Cat Stays Home. So that's in English and Spanish as well. So a variety of resources and supports there. And again, thank you, Jane, so much, and Wendy, for inviting me here tonight. It means a lot to me to be able to share just some words, hopefully of encouragement, and some resources, and to let people know that we're here for you.
It's so helpful. And you know how sometimes when we get on social media, we just click from one thing to the other and get lost in maybe a good way, maybe not, but you could do the same thing on your website. Just click on all different kinds of resources, read the book. I do want to let you know a couple of comments here. Thank you, Dana. I've noticed that the shelter in place has strengthened my meditation practice, a tiny silver lining. I enjoyed your square breath practice and the colors. And then another comment, thank you for closing calmly and the reminder that seeking help is a strength. In regular times, in quotes, 1 in 5 pregnant and postpartum women experience depression and anxiety. I can imagine it is even more during this COVID-19 crisis, and help is out there. Thanks again. And then there's the hashtag Moms Matter.
Oh, thank you. Yeah. Yes, fancy.
Yep, you know your people. That's great. Well, thank you so much. I'm just so happy to know that there's so many resources for people to kind of dip a toe in, and really to get started if we haven't, or to just add something extra in. I found that in addition to exercise and sleep and food and all the things I try to do regularly, the thing that has really made such a positive difference for me is making sure that I have at least one conversation with a friend during the day. It's as though it establishes my emotional well-being on kind of an even keel. So really just appreciate those reminders. And yeah. Any other questions or comments for Dana? I did have a couple of updates I wanted to let people know about. One is a couple of things about some food resources. I don't know, there are many people in our community who are out of work now, who are not accustomed to being out of work, who may need food resources, and who are not accustomed to asking for help. And so I just want to let people know, if you have friends or if you yourself are in need of food resources, the food stamp program, CalFresh, is available. It's a simple qualifying process, and there is added money added to the amount that people normally get. So in case your needs are greater and the food bank is running low on food, you can actually use CalFresh to shop at grocery stores. And in addition, you can find other support resources at the social services website called See for Yourself. The letter C, the number 4, yourself.com has, and there's Wendy showing there's food, there's medical, there's cash assistance. Really encourage people to reach out and get the assistance you need. And also, if you are parents of children in the school districts in Monterey County, and if your kids qualify for free or reduced lunch, and your EBT card will have extra money, $350 per child added to your EBT account for the next couple of months to help you get through this really challenging time, just on those basic needs like food. I also want to let people know that for some of the people in our community who are not sheltered and who have underlying medical conditions and are at risk for severe impact if they do contract the virus, there's a program to get them housed and provide them food and housing during this time, so that they aren't out at risk of they're less risk of catching the virus. So there's a lot of really creative and caring work that is going on out in the community. And I hope that all of you take good care of yourselves, as well as much volunteering and caring for others as you can possibly do. I want to thank you all for joining us tonight, whether you're on Facebook or on Zoom. Really appreciate your participation. And thanks again, Dana, for really making us aware of the resources that are available. And I encourage you all not only to be safe and be kind, but to join us next week at 5:30 for another virtual Hot Topics. And one of our special features next week is that it is going to be my birthday, so it'll be very festive, at least from my perspective. We may not do anything different, but you'll know that you can be with me as I turn yet another year older. So thanks again, everyone. Really appreciate your participation.
Thank you.